importance of implementation, understanding the importance of implementation research to overcome these gaps. So let's start with probably the most important question of the day, and is what is implementation research? So implementation research addresses the different effective interventions that don't have the expected results because of implementation problems. So how it addresses? Implementation research identifies and investigates problems that prevent effective intervention, effective implementation of that interventions, also develops and tests implementation strategies that provide possible solutions to these problems, and always obtain information to guide the scale up on the sustainability that are two special elements of implementation research. And always is also generating evidence. So now we're going to see a more graphic explanation about we mentioned before. So we're always start identifying the significant health problem. And before we have our significant health problem, we identify an evidence-based efficacious intervention. But when we are going to implement that intervention to solve the significant health problem, in the real life, no under control conditions, we're going to find some problems. So here comes the implementation research. First, to identify those problems and the possible reasons, and then to design and test different strategies that can solve them, always generating evidence. Now we want to share a short example to better understand of this short explanation that we gave and apply some of the concepts of the graphic, but based on this video. This malaria example is from IR book.
In Africa.
Nigeria. More people live here than anywhere else in Africa. This baby girl has a serious fever. It's malaria. For 2 days, Sherifat Jamoa has been giving her daughter, Grace Abba, medicine brewed from herbs and bark. Grace, who is just 3 years old, is in a bad way and needs proper treatment. But the nearest help is 26 miles away. Sherifat has no option. She has to walk. Like most women in rural Nigeria, she can't afford to take time off whenever one of her children gets sick. According to the World Health Organization, malaria claims the lives of over 270,000 children in Nigeria every year. That's a third of all the children who die of malaria in Africa.
Now,
perfect. Now we're going to see the question. So my colleague Charlotte is going to put a link into the chat box. This is similar to Mentimeter that we use in the past sessions, workshops. And you just have to click on the link and you will see the questions.
We'll just give a couple of minutes to think about what is the health problem, first of all, in this example.
If you want, you can also answer by the chat box. It's okay.
All right, so we can start and look. So it should, the largest problem or most identified health problem should show up here, largest. So it looks like, yes, we have malaria, lack of access to maybe health treatment, lack of access to healthcare, lack of access to treatment services. But yes, overall, we do see malaria here. So we're going to go to the next question now. So about the efficacious intervention.
What do you think that could be the efficacious intervention that could solve that problem that is malaria. How we can solve that problem.
Great. Definitely. Yes, these are all very good answers, and it's very diverse. I'm sure many of you have worked maybe with malaria before, so kind of thinking about the intervention, it's great to see that there's a variety here. So we have drugs for malaria, malaria treatment, access to care, health attention, timely healthcare, definitely. Community doctors with medications. We'll get into kind of the provision of the treatment as well. Awareness, early treatment, the availability of drugs, access, awareness, prevention and awareness, definitely. Vector control, great.
On the chat, we also have drug for treatment, lively settings, vector control, accessibility for all.
Awesome.
Perfect.
Alrighty, so we're going to move on now to the third question.
Malaria case management, anti-malaria drug supply. Yeah,
Great.
perfect. Community-based treatment for malaria.
Awesome.
So, despite we have an efficacious intervention, like you mentioned, some of that, like we have a malaria treatment. So there is a problem, an implementation problem. What do you think that could be the implementation problem according to the video?
Access, for sure. Distance, kind of like what they mentioned in the video of the.
Remember that we have, for example, the malaria treatment, and we have our significant health problem that will be malaria. So how could we are going to implement that treatment into the real world? But in Africa, we're still having problems. So how will be that implementation problem? Why we can't give just the treatment for them? What is the problem there?
Great. So yes, transportation, we have quite a few of distance, geographical distance between the community and the healthcare provider, isolation, service delivery, poverty, which can be interrelated with many of these. Accessing treatment, low income, definitely. Time available, yes. So these are great, identifying a whole bunch of implementation problems that aren't just limited to what we saw in the video, but definitely you are thinking outside of the box. Alrighty, so we'll just look at a couple more of these. Access to treatment, definitely. Drug supply, governance, finance, for sure, thinking about that more outer layer of problems. Great. Okay, so we'll move on now with the remainder of the presentation.
Perfect.
All right. So I guess we'll see here.
Yeah, so according to your answer, and thank you for your responses, we're going to complete the graphic that we saw before, but now with the specific information that we got from the video. So we have our significant health problem that is high prevalence of malaria, some of you said, and we have the efficacious intervention that it will be anti-malarial drugs or malaria treatment, as you said. But then when we are going to implement that anti-malarial drugs into the real world, into a real context, we are going to find some implementation problems. Difficulties in accessing health services. We selected one big implementation problems, and here's come the IR to analyze the problem, identify the exact or possible reasons, and develop the test and test different strategies that could solve that problem. The main objective of the implementation research is to integrate evidence-based interventions and research findings into health policy and practice in real context. And our principal characteristics is a systematic process, so it's a rigorous and deep research process that requires data collection. It's logical and always generates evidence. And real-world settings, because in these kinds of projects, we work directly with the community who are affected by the different problems, by the different health problems. And it's not under controlled conditions or controlled settings. Is contextual because the entire process of implementation research is based on the local needs and local health and possibilities. Is multidisciplinary because we not only analyze the health as an independent factor, we also have to analyze social aspects, economic aspects, political aspects. So to do that integral analysis, we have to count with different professions in the teams to can provide an implementation strategy more integral. And all these characteristics made implementation research complex process because it's also adaptive. So I have to adapt my strategy according to the context and according to the acceptance of my community.
Great. So as we've kind of gone through and discussed, there are quite a few key concepts that we need to understand individually in order to better contextualize what implementation research is, what it involves, and what it results in. So we'll now take a moment to look closely at some of these key concepts related to implementation research. So this diagram here is based on an example from the University of Ghana's Introduction to Implementation Research course, and it displays the key concepts and how they relate to one another. So the first here that we'll look at in detail is the intervention. So as we've discussed, interventions are discussed commonly in the context of medicine and public health. And in implementation research, the intervention is basically what is being implemented to address the public health problem of interest. It's also important to refer to it as the efficacious tool, since it must be proven to work in addressing this public health problem. So it includes both the what that we can see here on the left, as well as the how on the right of the equation. So the what refers to the actual activity that makes up the intervention. This is usually a biomedical activity, such as antimalarial drugs, like we mentioned before, that are given in a specific format to a defined population. But these can also be behavioral activities. So this could be like an educational program, teaching about awareness or the importance of using insecticide-treated bed nets. So the how on this side involves the actual implementation activities that are required to achieve full and equitable coverage of this efficacious biomedical or behavioral intervention. So these also involve processes that are initiated to ensure the adoption of the intervention within the community. So interventions, like we mentioned, could be antimalarial drugs, insecticide-treated bed nets, in addition to educational guidelines, the implementation of packages or policies, as well as changes in the actual health delivery system itself. What's most important about all of these interventions is that they must be proven to work. So in some cases, an efficacious intervention might be old, it might have been in existence for some time, but the implementation of the intervention runs into problems. And this is where implementation research comes in to tackle these implementation problems that you identify. For example, with malaria, there are, as we know, a variety of effective antimalarial drugs, prevention strategies, and guidelines that have existed for several years. But despite their availability, these implementation problems mean that malaria still continues to be a serious public health problem. On the other hand, we have some interventions that are very new and might just be being introduced for the first time within a community. In this case, implementation research both investigates the potential implementation problems that could arise during the provision of this new intervention, but it also tests or carries out implementation strategies to combat these identified challenges. So the next key concepts, like we just mentioned within the context of the intervention, are implementation problems. So these are challenges which make it difficult for the intervention to reach the intended populations that are in need of them. Implementation research problems can be either rooted within an existing problem in general health service delivery, they can be embedded within a particular element of a program, or they can be evidence-based. By being evidence-based, this could mean, for example, based on statistics and the lack of coverage of an intervention among a population. So these implementation problems can be due to complexities related to several reasons, such as poverty, community factors, such as community readiness to uptake an intervention, poor access to healthcare services in general, patient adherence to treatment guidelines or their ability to have access to treatment, organizational readiness to actually carry out an educational program, or practitioner acceptance of a treatment regimen. So implementation research aims at addressing these identified implementation challenges, like we saw in the graph, the arrow going in and meeting where the implementation challenges or problems come in. So a concept related to implementation problems is the formulation of these implementation research questions. And these are the questions that will actually guide the course of the research. So a good IR question should include the following elements. Describe the intervention and what the health intervention consists of. Describe the intervention and the existing health problem that it intends to tackle. Describe the population or the stakeholders that are involved in the implementation strategy. So as you can see on this table, these questions can be exploratory, descriptive. They can look at the influence of a certain force. They can explain something or predict the outcome. This table basically shows some example research questions for each different research objective. So let's first look here at the top at exploratory research objective. So this looks at the question, what are the factors affecting why a cervical cancer screening strategy is not reaching individuals who need the services? So as you can see, it describes intervention, which is a cervical cancer screening strategy. It describes the health problem, which is cervical cancer. And finally, it describes a population who are individuals who need these services. So the reason it's exploratory is because it's looking to identify the factors that affect this lack of coverage of cervical cancer screening, but basically getting to the root of understanding what the problem is. So for a predictive research objective, we could, for example, have the research question, how do you expand the use of insecticide-treated bed nets to prevent malaria transmission among children under 5? So this question meets all three of the suggested requirements, and it's predictive in that it looks at what the effect of scaling up these strategies would have on malaria transmission. So next we can look at the implementation strategies. Curran and colleagues defined implementation strategies as methods or techniques used to enhance the adoption, implementation, and sustainability of a clinical program or practice. So as we stated before, implementation research doesn't only identify these barriers, but it also looks at how to overcome them. But it's important to note that these don't only exist in a clinical context, but these can be any kind of strategy created to carry out a public health intervention, the action of carrying out that intervention. So implementation research strategies are distinct from these efficacious tools that are used as interventions. These are instead strategies to overcome the gaps that we identified during the implementation of interventions or policies. So with malaria, an intervention or the efficacious tool would be, for example, insecticide-treated bed nets, like we mentioned and like someone wrote in the chat before. So these, when used, they reduce the number of malaria cases. But due to implementation problems, for example, low coverage among populations in need of the intervention, so low coverage of bed nets or lack of access to bed nets, this would cause these implementation problems. So we need implementation strategies here. We need to design them to improve the coverage among the population in need, which would involve researching the most effective and sustainable methods to distribute bed nets and ensure that they're used properly. So in a WHO document outlining a community-directed intervention for major health problems in Africa, they highlighted a community-based distribution program of insecticide-treated bed nets as a successful implementation strategy. So we'll now take a look here at the actual outcomes. So the implementation research outcomes, which are commonly referred to as IROs. So according to Proctor and colleagues, IROs are the effects of deliberate and purposive actions to implement new treatments, practices, and services. So these are constructs that describe the actual effects of these deliberate and purposive actions used to implement an intervention. They're basically used for measuring the success or the failure of these implementation strategies that we just discussed. Some common constructs that are used as implementation research outcomes are acceptability, adoption, appropriateness, feasibility, fidelity, implementation cost, penetration or coverage, and sustainability. So to look at a couple of these IROs in more detail, we'll first examine acceptability. So this is defined as the perception among stakeholders that the intervention is acceptable. It's related to the comfort of the stakeholders and whether they think the intervention is agreeable, whether they see any advantage to uptaking the intervention, or whether they see the intervention as credible. So sustainability as an outcome here at the bottom is defined as the extent to which an intervention is maintained or institutionalized in a given setting. This is connected to the maintenance or the continuation or routinization of the intervention within the specific context that it was initially implemented in. So notice here, when we discuss implementation research outcomes, we're not actually measuring the direct impact on health outcomes like clinical symptoms or mortality that are measured maybe at the individual or the population level. So these can be used as outcomes of treatment efficacy or effectiveness, but are not implementation research outcomes on their own. So improving these numbers on mortality or disease burden are extremely important in implementation research, but it's not the immediate goal of it. So if we look at the research spectrum, implementation research falls somewhere in the middle. It's more focused on identifying the elements of each specific context that contribute to the negative health outcomes with the end goal of improving overall health and well-being, but then improving those numbers is not the immediate outcome of it. So finally, as you've heard us refer to of efficacy and effectiveness, this was something that really challenged me to understand the true difference between these words. It's very important to distinct them from one another. So efficacy and implementation effectiveness aren't the same, and we should understand why. So looking at intervention efficacy, this is the effect of an intervention under controlled settings. For example, in the context of malaria, this would be a clinical trial looking at the effect of a drug for treating malaria. Intervention effectiveness is the effect of an intervention, as we talked about above, in a real world setting. So for example, this would be the real effect of this efficacious treatment for malaria in a specific community, so not under controlled settings. And lastly, implementation effectiveness is the effect of efforts, and these can include strategies or actions to deliver an effective intervention in new settings other than where it was previously tested for effectiveness. So this is usually conducted within broader populations under real world conditions. An example of this in the context of malaria, again, would be the effect of a community-based intervention working with community health workers to provide this efficacious malaria treatment to those who need it. So I'm going to show a diagram on the right, which is adapted from the University of Ghana's Introduction to Implementation Research course. And it shows how the combination of an efficacious, but ideally also effective, so effective under real world conditions, intervention, meaning that it has shown and proven effectiveness in a real world setting, combined with implementation effectiveness, so this is the process of successfully getting the intervention to those who are in need of it, will result in improved health outcomes under real life conditions.
Now we're going to see something with the related research, because implementation research is often confused with other very similar and related research areas. It's important to make the distinction between them, as well as understand what the scope of implementation research is and in which context it normally takes place. So in this arrow, we will see what we're talking about. Intervention research comes before implementation research. The purpose of intervention research is to develop and test effective interventions, usually under controlled settings. On the other hand, effectiveness research, which evaluates the effects and impacts of the intervention of the disease in real-life contexts and conditions. Then implementation research, where problems are identified and investigated that prevent effective implementation of those interventions. Implementation research and effectiveness research are very closely related, since both focus on the implementation of the intervention in real-life conditions. They can be combined in one research project, but the methodology, scope, and objectives of each of these types of research are very different. At the same level of implementation research, that some were related to implementations and are operational and health system research. So in the diagram, we can see operational research involves solving the operational problems of focal health programs and has a much narrower focus. Health system research involves the study of system problems that affect the performance of a health system as a whole and has a much wider focus. The borders between these types of research are quite blurry, and they overlap in many areas. There's not much a need to be able to define between these three kind of research. The importance is in clearly defining the objectives of this research being carried out. Now we're going to see the phases of the IR, who has three clearly defined phases. So phase one is where we define the implementation problem. In this phase, we have to do a context analysis when the social conditions, economic, political conditions. It's not only the health, it's the health, but in relation with other social determinants. And also we have to identify the reasons for the implementation problem and generate information and review the literature. Then in the second phase, we design the implementation strategy. So according to the information and with the literature that we review in the first phase, we're going to do a brainstorming or another methodology to think in different possible solutions. And then we design and improve implementation strategy. And finally, in the third phase, we test the implementation strategy. So we are going to evaluate our strategy according to the outcomes that we selected. And we compare the implementation effectiveness of a new and with the old strategies. Now, we are going to share a case study that is a research from Colombia in Girardot focused on dengue. And we want to make some questions at the end, just to apply the concepts that we saw during the workshop in this real case, and to be creative. So Girardot is a town located to the southwest of Bogota, the capital of Colombia, on the banks of the Magdalena River. Despite public health efforts, it remains an endemic area for dengue. To respond to this problem, a team of researchers carried out a project with the participation of decision makers, academic, community, and implementers. In the first phase, they conduct a context analysis and literature review and identify. First, that there is a common cultural practice of home water storage in cement tanks due to frequent water cuts that used to occur in Girardot and still do in some neighborhoods. So here in this slide, we can see some photos of cement tanks from Girardot. The second finding was the water stored in the cement tanks is used mainly for household cleaning. So although a justified cultural practice, this home water storage was also becoming a public health problem because studies indicated that these cement tanks were breeding sites for mosquitoes. In the process of reviewing the literature, the research team found that previous studies have shown that insecticide-treated nets were an effective intervention to prevent some vector-borne diseases. So, according to this specific information, are you up for brainstorming impossible solutions? We have the health problem identified, and we also have the efficacious intervention. Of course, in reality, this will be a rigorous and a systematic process as we saw at the beginning of the workshop, reviewing only evidence-based intervention as a part of a second phase. But just to be creative, we just want to think in possible implementation strategies to solve that problem. We have a justified cultural practice of storing water in cement tanks, but these tanks are our main mosquito breeding sites. So we have an intervention that has been tested in controlled settings that are the insecticide-treated nets. What innovative idea, either using nets or a different idea, do you have to solve that problem?
Great. So we're going to open up the poll again. It should be the same link. Here, yes, as Kate said, what innovative idea, either using the nets or a different idea, do you have based on the context of this case study? We'll leave this slide here that has all of the information you might need. There's a lot of information, obviously, that is not there that we couldn't include, but based on this information that you can see on the slide, what might be a strategy, an implementation strategy that you could come up with. And then we'll share what they actually did. So we'll leave this open for a couple of minutes, and then we will go back and see. Let me make sure it's open here. All right, yes, they've started to arrive. Ooh, okay. I'm excited to show some of these, these answers. Wow, these are so innovative. Okay. I'll wait a couple more minutes just so people can come up with their own ideas, and then we'll see.
We're gonna have our Jeopardy music now. Dun.
Be creative.
I love these ideas. All right. Should we reveal the implementation strategies, or leave a couple more minutes?
Okay. Also, you can write in the chat if you want.
Great. All right, I'm going to turn it over. So we'll go here to this next question. All right, so a possible implementation strategy. I think these will come in and show all of them, hopefully. So we have facilitating access to antimalarials, covering cement tanks with mosquito nets. This is a great idea. Using a cover for the tanks, yes. Covering the water reservoirs with the nets, definitely. Covering cement tanks with a cover. I think people are catching on to what the solution might be. But also these are great to highlight. For example, the educational strategies. So providing education to the community, other water storage mechanisms. So they've, definitely identifying what the implementation problem is and the justification of water storage. So alternative ways. Let's see what else we get. Health education, other methods to store water, other non-harmful chemicals to prevent breeding of mosquitoes. Kate, can you remind me in this context, did they use insecticides like spraying in the community? But
yeah.
Campaigns for promotion of net use. Rainwater tanks.
Also in the chat, we have some answers. Women advisor to fight malaria, engaging the community members and citizens to fight for their health. Water tanks have to be removed. An example was done in Ghana in a town called Kutunse.
Cool.
Clean semen tanks with chloride. Youth advisor to fight malaria. Children advisor to fight malaria.
Here we have more governance level, getting the government to provide pipeline water to overcome the challenge of the frequent water cuts. Treated nets to protect water points and getting exposed. Something to cover the tank, proper water storage. Great. These are all awesome ideas and very innovative, and some of them are very close to what the actual research team decided to do. Here we have also in the chat, making sure that everyone in the community has mosquito nets are being used appropriately and pragmatically. And those who are infected gaining access to antimalarial drugs. Definitely.
Remember that this example, this case study is based on dengue. Also that's infected. Okay.
Yes. And we can send a link in a few minutes, but this actual case study, we have an article that we can send the link to, and you can read more in detail about this specific case. All right, should we go back and look at the actual strategy, Kate?
Yeah, you were so close for the strategy. I think that you got it. Yeah, so let's see what the research team designed for this. So this was a participatory process. It was a multi-sectoral strategy that was designed and implemented. Not only the research team, it was designed and implemented with the community members, with decision makers. And so it's an important component of implementation research. And the first component of the strategy was designing covers for the cement water tanks made with an aluminum frame and long-lasting insecticide-treated nets. So that you said in your responses. So that's amazing. As you can see here the cement tanks in the porous with that covers with insecticides. So it was a participatory process, the first component also, because the covers was fabricated by different local providers. So it's an important aspect too of this experience. The second component of the strategy was designing curtains for doors and windows, also made with long-lasting insecticide-treated nets. It was also participatory. The tailors from the community fabricated that curtains for the doors and windows. And the third component was the training spaces in school in Girardot for educational programs on dengue prevention. That is really related with what you said about the educational programs or children ambassadors. So you were really close. Another fundamental aspect for the strategy that is important to highlight is, as we mentioned, the participatory component, because it also helps to build that trust and contribute to the acceptance to the community to respond or to accept this strategy.
Great. So in the third phase of the implementation research process, like we mentioned above, the actual implementation research outcomes are assessed to determine the implementation effectiveness. And I just saw a question in the chat about how these outcomes are actually measured. And they can be measured through a variety of ways. They could be surveys, qualitative interviews. They could actually be looking at how much coverage there is among the community, the implementation cost. So they can be measured in a variety of ways, but a lot of them about acceptability in the community, for example, that would be through one-on-one qualitative interviews or surveys or focus groups within the community. So remember the table that we showed earlier of these common constructs to use as IR outcomes. You can see in some of these possible answers, some of those that are there. So trying to remember some of the definitions or what you remember from those definitions. But for this case, what implementation research outcomes would you choose to assess to determine how successful or unsuccessful the implementation was? So we have these four options and you should pick what you think is the most appropriate answer. So it should have this fifth question now. So I'll leave it here for a couple of minutes and then we can look at the answer. Yes, and just to remind everyone, this, although we were talking about the context of malaria earlier, this specific case study is dealing with dengue.
Yeah.
Okay, so we have some votes for the third option here in the chat, and then I'll go ahead and show. All right, so we have, looks like most of the answers have come in. So here we can see the distribution. It looks like the majority of the people chose C, some for A, some for D, but no one for B. So this is a tricky question since a number of these constructs could apply to the present case. But remember that we said earlier about how implementation research outcomes are not equivalent to these health outcomes. So in 3 of these answers on A, B, and D, we can see that there's the number of dengue cases or number of dengue deaths. These are both classified as health outcomes. So this third option is the only one that actually only has the IR outcomes. And these researchers used coverage to look at how much of the community received the intervention, acceptability to assess whether the community perceived the intervention as appropriate or not, and implementation costs, so the economic impact of the intervention. And lastly, the sustainability is related to whether the intervention was scaled up or sustained in the specific community or not. So thank you very much for responding to those. It was kind of a trick question, but here you can see we have sustainability in all of them. So that's important to look at within implementation research. All right. So just to give some ideas and some overall conclusions from this session, thinking about the importance of implementation research. So it aims to overcome these bottlenecks that interventions have on health effects. It generates evidence about implementation strategies. So this evidence-based implementation that can be used in other contexts or within specific other communities. It improves overall understanding about the key factors that cause implementation problems, and remembering that across different communities, across populations, these implementation problems, even if it's for the same intervention, are different and they vary and have different effects. And then enhanced large-scale utilization leads to significantly higher health impact. So thinking about the scaling up and the sustainability of these interventions, although we said that that's not the immediate impact of implementation research, it is the ultimate impact, and the ultimate goal of it is to lead to these significantly higher health impacts. And lastly, it fills an important gap in the research overview. So I don't know if anyone has any ideas of other kind of importances of implementation research that they have identified either previous to this workshop or throughout this workshop. If you might want to share in the chat. We can see here. Great. So paper for the study. Let's see. I have it here. I'm going to send this paper one more time to the study, the PDF. All right. Well, we're open to any questions. If anyone has any doubts or questions about implementation research, as we said again, we're not experts on this topic, but we are learning continually, and we've taken the implementation research MOOC and have worked with some highly skilled supervisors that have helped us and guided us through the presentation. So thank you very much for listening.
Thank you.
This was great, Charlotte and Kate. Fantastic. Do you want to take a few questions? I think I saw a bunch in the chat box from before, sort of along the way, but is that okay?
We can try, yes.
Yeah.
Don't worry. I won't, well, it'll be gentle. Let's see. You've already talked, or I think you answered this before in the chat, but what are some measurements of implementation research outcomes? It might be good to go over. And I guess the other thing is, a related question is like, what are some common conceptual approaches or frameworks that people use to organize implementation research outcomes?
I don't know, Kate, do you want to answer or should I try?
Yeah, about the first part, yeah, we mentioned something, Charlotte said something about that before, and we can use different strategies, different methods, surveys, focus groups to evaluate our outcomes.
Mm-hmm. And they're usually at different moments within the actual implementation process. So some implementation outcomes you can assess at each point, like early, middle, and end of the implementation research process. Sustainability, for example, might be measured later within the process, but can also be measured at different moments. Feasibility, again, this might be measured early during the actual adoption of the intervention. But other methods are like checklists, observations, administrative data, maybe from from clinics or from actual health programs. So there's a variety of ways to measure in it at different moments within the process.
Yeah, for example, acceptability, I think that we can also measure that in different moments, because if we have to adapt the strategy, some aspects to be more acceptance for the community, so we have to do it. And that's why implementation research, it's not linear, it's an adaptive process.
Mm-hmm.
Yeah, I completely agree, Kate. It's not like you need to think outside the box and be creative and capture both the sort of process as well as the outcomes. It's a great point.
Yeah.
The other, there's a lot of sort of acronyms that for these conceptual approaches. A common one is called RE-AIM. I just put the URL in. And then another sort of framework for thinking about measuring implementation research outcomes is called CFIR, CFIR. And that's, it's basically sort of a another larger kind of way of thinking about organizing implementation research outcomes. Just looking at the chat box, we have a question here from Mariam about how do we tailor, things change quickly. How can we tailor implementation research? And I think this really gets at what you were just saying, Kate, about being adaptive. Like, what are, how can we tailor? How can we adapt? What are some ways that implementation research can change?
Definitely.
How can we do implementation?
Okay. Probably changing context. Yeah, I mean, within, for example, the case study that we just talked about, they ran into many challenges along the way. For example, changes in government administration that led to complications in the people actually implementing the project and the sustainability of the people working within the project from the part of the local government. So it can run into many challenges, but definitely what we talked about of being adaptive and kind of, you're going to identify implementation research problems from the beginning to the end, and the ones that exist from the beginning aren't the same ones that will exist at every moment in the actual process. So kind of having a continual identification and assessment of what implementation research problems exist.
Yeah, I completely agree. The other thing, there are specific study designs that come up. And in particular, like one example would be what's called SMART, sequential multiple assignment randomized trials. And what you do for those kinds of implementation studies are, if you know beforehand that, for example, there may be a group that has very low retention, and you anticipate this, and then you could say, all right, this arm that isn't where they don't respond to the intervention, we'll give them an additional intervention, or it's sort of building into your plan some possibilities and contingencies. And so there's definitely a whole bunch of implementation studies that have done that, and it's really, I think it's cool because it allows you to kind of use what you have and to observe trends and not just do it in a sort of reactive way, but actually kind of plan beforehand and say, all right, we think that this outcome is fairly likely. Let's see. We have another question from Anita. How can we use implementation research and quantitative research methodology? And then another question from Vita about how could an organization or healthcare system scale up implementation research? And then another question from Juan about could cafe forum techniques work for assessment and redesigning the implementation throughout the process? And I think I wonder if the cafe forum, it's sort of like a world cafe. I wonder if that's what Juan is talking about. I know I'm a little more familiar with that context. Another question from Lorena about how to strengthen community engagement in the IR process, mixed methods, materials that you can recommend, how can you register? Some of these questions we can put responses into the chat box. But for Charlotte and Kate, do any of these topics, are there any specific questions that you'd like to focus on?
I would like to address how could an organization or a healthcare system scale up implementation research and output, just to highlight the importance of articulation between different sectors. And in that way, it's like more the probability to can scale up this. So it's important to, from the beginning, start to communicate with the decision makers, with the research team, providers, implementers, and really important, the community. And I think that when this is multi-sectoral and we have like the contact with different stakeholders, it's easier to achieve the scale up, or is more probable. Because the idea or implementation research is to include this in public policy. So in that way, we can maybe give more safety, or to have more sure the scale up.
Definitely. Related to this question on whether implementation research is used in quantitative research methodology, there's a paper here I was thinking about within the evaluation of the outcomes, evaluating them quantitatively. So kind of this would be more in the evaluation stage of the methodology, but I've put this here in the chat as well. Let's see, we have strengthening community engagement in the implementation research process. So definitely within like the case study that we just referred to, thinking about this multi-sectoral kind of group. And I don't know if we want to bring up the kind of, if any of you have been in here for the social innovation and health and the introduction to social innovation and health, the connection between implementation research and social innovation and health, since I think that really points at the community engagement.
Yeah, and something important is how we also evaluate the real needs from the community, but with the community, because it's not a research team just arrive to the community to show what do they need. It's just to construct together and identify together the real needs, the local needs, and then think together in possible solutions. In that way, we can have like strengthen the community engagement, because the community will participate in every steps of the implementation process.
Definitely.
And recognize also the importance of their local knowledge, their local conditions, and receive like always feedback from the community.
Mm-hmm.
Because if the community isn't empowered, so I think that the strategy won't be successful.
Definitely.
Yeah, and one other question from Vita that I think is an important one. In many LMIC contexts, implementation research is like a shoestring budget. We say shoestring budget in English, which is like, there's no budget, right? It's like you have your time and you can pour your time into it, but like, how do you do implementation research on a very limited budget? And I think this is actually where this is sort of the strength of implementation research, that if you have a program and it's already going on, and to take the dengue example in Colombia, the national dengue program is planning a structural intervention that's going to be, they're going to be doing this program across all the regions in Colombia. And so implementation research there, it might just be as simple as like coordinating so that the timing of that is staggered, and it could be a stepped wedge trial, or there's a bunch of different ways of thinking about it, but part of the beauty of implementation research is definitely that compared to a lot of other types of studies, it does require fewer resources, and I think that's something that makes it particularly appealing for trainees and grad students. And you still need to do some, it's still important to have a really specific hypothesis, but in terms of like finances and resources, I think that can be one important point. And then the other part that goes back to what Charlotte was just mentioning, the sort of links with social innovation. If you do have strong partnerships with the community, if something is really community engaged, that can also be a source of in-kind support, so that you're not raising money for something exogenous, but you're more working with a local partner and helping them to design some research to evaluate what they're doing. So yeah, this is fantastic. Thank you so much, Kate and Charlotte. A round of applause for both of you. Our next pair of speakers on August 9th will be Uche and Gifty. They're going to be talking to us about monitoring and evaluating social innovation. And so in many ways, a lot of the kind of methodological measurement issues that we started to talk about today will be continued next week, with a focus on the sort of social innovation part. So that'll be the same time next week on August 9th. And remember to complete the survey that Yusha just put into the chat. And thanks again to everyone. Great presentation, Charlotte and Kate. Thank you so much.
Thank you, everyone. Nice to see you.
Thank you, everyone.
Take care. Bye.
Bye.